Hello, I went and saw our patient. He's a 77-year-old male who was brought into the urgent care by his neighbor because she was concerned about how he was feeling. He said he came in because he's not feeling well. Last night he started to feel very tired. He took a nap and he was having some frequent urination, some burning with urination, and some pink tinged red urine. He said he started to feel fatigue and chills, and so his neighbor decided to bring him into the clinic. On my exam, on my physical exam, he had clear lungs, his heart rhythm was regular, no pain on palpation. His vital signs did come back elevated. His blood pressure was 178/90, heart rate was 122, and temperature was 100.2. Based off of what the patient was telling me, as well as my physical exam and his vital signs, I would work him up for a UTI. I would also consider kidney stones, and then I want to consider his hypertension and diabetes as secondary. So I'm considering UTI because of his symptoms of burning urination, frequent urination, bloody urine. He's also having systemic symptoms such as the elevated temperature, blood pressure, and heart rate, and then he's feeling fatigue and tired. Kidney stones because of the frequent urination and the burning and the bloody urine. However, typically with kidney stones, you don't have that fatigue and you don't have the elevated temperatures. His blood pressure was also elevated. The patient did state he did not take his blood pressure medications this morning. However, I want to make sure that this is an exception and not the rule. And then his diabetes, he did not currently take any medications for diabetes, and he mentioned that his blood sugar was elevated. So at this point, I want to ask you if this is appropriate to treat outpatient, or should I consider hospitalization? I am considering outpatient just because he was learn-oriented and he was able to teach back and respond appropriately to our appointment. At this point, I do want to get a UA on him, a CBC and a BMP. I want to be able to give him an antibiotic if that UA comes back positive, specifically Bactrim for 14 days, and then have him drink lots of water. And then I told him to call back if he doesn't feel better in 2 days. I also encourage him to check his blood pressure and keep a log of his blood pressure and contact his primary care doctor to follow up on his blood pressure and his diabetes. And then from this case, I do want to learn more about treating an acute case when a patient does have chronic illnesses that could be contributing. I would love more practice with that. Thank you.